everyone, and welcome to Pittsburgh Now. I'm Chris Moore, the Moore of Pittsburgh. Our number here is 412-333-PCNC, and you should dial that if you'd like to join us as we discuss the following subjects. We're going to talk later in the program to Dr. Anthony Davis about an essay he has written about busy bodies and busy bullies in this age of political correctness. Actor Taye Diggs is going to join us later in the program to talk about what you could do with your kids in a virtual summer camp. But we begin our program talking about the coronavirus. Why is it that the death rate is so low with this resurgence of the coronavirus, both nationally and locally? We'll talk to an infectious disease expert about that in just a moment. But first, let's get some background with this report from NBC's Stephanie Gosk.
A tale of two graphs. On the one hand, a disturbing rise in new coronavirus cases. On the other, the heartening news that the number of deaths is going down from more than 2,000 a day in May to now roughly 300. But neither graph alone tells the full story. We reached out to 5 doctors in hard-hit areas of the country to find out what's behind the numbers. Testing. The country is getting better at finding the virus. In early April, 100,000 people a day were being tested. Today, the number is roughly 600,000. But it doesn't entirely explain how quickly the case numbers are going up.
How much does increased testing in Arizona explain an increase in the cases?
Not at all. In the city of Phoenix, it's 20 or 24% is the percent positive for the new tests for COVID-19. That is it's just a terrible number.
Age is another factor. Fewer people are dying, experts say, because younger people are getting the virus.
Young people are going out. They're visiting places that have reopened. They're going to parties, unfortunately. They're taking some risks.
In Arizona, at least half of all positive cases are in people between the ages of 20 and 44.
They absolutely are spreading this to those who are in their 60s, 70s, 80s, and in more vulnerable populations.
Deaths will also lag behind cases.
We're generally seeing that patients are becoming symptomatic by day 8 and 9. Complications from COVID and mortality can lag several weeks.
Also keeping death numbers down, better treatments.
Initially, we were intubating everyone, and then we were finding, you know what, there's some other oxygen treatment therapies.
Now, what we do is we try to avoid intubation as long as we can because it was hurting people's lungs. We use proning, which is putting people on their stomachs, and that has been extraordinarily helpful.
And there are new drugs like the antiviral remdesivir, shortening hospital stays, as well as a steroid for lung infections. Today, while President Trump asked the country to celebrate the death rate, Dr. Fauci warned Americans not to fall into a false complacency.
It's a false narrative to take comfort in a lower rate of death.
As for the experts we spoke to, we asked them all the same question. Do you expect the death rate to go up?
Yes, I do.
It's certainly possible.
The number of people who die from COVID will continue to increase.
Unfortunately, I would say yes.
Yes, it will.
All 5 reaching an unsettling consensus. Stephanie Gosk, NBC News.
And here to discuss this further with us is Dr. Amish Adagja. He is an infectious disease expert. He is also a scholar at the Johns Hopkins Center for Health Security. Welcome back, sir. How are you?
I'm good. Thanks for having me.
All right. Back in January, you came on our program, and since then you've become quite in demand on a lot of different networks, and you warned us about this virus. I recently read an article where you were quoted as saying you are not surprised at the number of cases rising again. Why is that?
Because this is a virus that established itself in the human population. It's not going anywhere until we have a vaccine. And the virus is just going to flare up anytime there's social interaction. So we have to expect that we're going to see increasing cases. This is the new normal, and I think it's important not to look at it as a scoreboard, but to make sure that we're prepared to take care of those cases, that our health department is fortified, that our hospitals are okay, and we have to kind of move forward knowing that we're going to get cases.
It's interesting that you use the scoreboard analogy. I've also read that you say that you follow viruses like some people follow football teams, that viruses are your life. Why have you dedicated yourself to this?
I think they're just so fascinating. I think infectious disease to me is one of the most intellectually challenging and stimulating subjects. And I've always been interested in it since I was a little kid, reading stories about Louis Pasteur and discovery of the rabies vaccine. It really is, when you look at a pandemic, it really impacts all aspects of society. They have so many cascading impacts. You have to know a little bit about everything to be able to think about a pandemic. And I think that's really, to me, intellectually stimulating and kind of the subject of the endless fascination that I really can't ever get enough of.
Has the coronavirus taken over your life and taken you away from studying other viruses that might be on the horizon?
Oh, definitely. Right now, the coronavirus is the major factor in anything I do every day. I basically have to keep up with a lot of data and a lot of research going on every day. And obviously in the hospital, we're seeing patients with coronavirus. But I do think that we're not spending as much time thinking about pandemic influenza, for example, or HIV or antibiotic resistance or all the other myriad infectious disease threats. And I think the coronavirus is the most pressing threat we face right now. But I do like to keep up with all of the other infectious disease outbreaks that are going on and have kind of receded from the headlines.
Given what you've just said and how these infectious diseases have receded from the headlines, is it the media's fault that we're paying too much attention to COVID-19?
No, definitely not. I do think that this is something that needs a lot of attention because this is a threat to all Americans right now as soon as they step out the door, and we need to get important information to them. But it's important to remember that we still have to think about other threats, West Nile fever, for example, influenza, measles, tuberculosis, HIV. There are so many infectious disease threats that are on the horizon. We have Ebola outbreaks in the DRC. All of that needs to be thought about, and we want to make sure that they all get the requisite type of information. But right now, coronavirus should be the threat that everybody is focused on because it is disrupting even the treatments for all of those other diseases like HIV or vaccination for measles or polio eradication. All of that is being impacted by this pandemic, and we need to get it under control as quick as possible.
You are also a critical care physician. What sort of cases are you seeing right now, and what does it tell you about the spread of the disease?
So right now in southwestern Pennsylvania, coronavirus hospitalizations are at a very low level, including in the intensive care unit. So right now, I haven't necessarily over the last couple of weeks seen very many fresh coronavirus patients. Early on in March and April in the ICU, I did see some very, very critically ill patients that some of whom died. But in the last several weeks, I would say there's been less ICU admissions, at least that I've been involved in, which I think is a good sign that we're doing okay in terms of hospital capacity and not seeing pressure there. But, we will expect to see more cases that end up in the ICU, and we will see more deaths in this area. The question will be, can we keep the pace to a level that's manageable by the hospitals? And fortunately, in western Pennsylvania, we have major healthcare systems that do have a lot of excess hospital capacity that can be used to absorb the number of cases we get. So I think we're much better off than other parts of the country, even with the increase in the number of cases that we're seeing.
So what do you think of the governor's outlook on this and the Department of Health saying that we should all wear masks once we venture out of our homes?
So this has been something that's been a little bit controversial, and it really didn't need to have this type of controversy, but it became a political statement, and we moved away from understanding the science. So we've always said that if you are somebody that is sick, if you have symptoms of this disease and you wear a mask in general public, you'll decrease your ability to transmit it. So it serves as source control. The question then became, are there people out there that have such mild symptoms that they don't notice, or maybe they're pre-symptomatic and they're about to get sick, and are they contagious? And that's why the mask guidance changed, saying the general public should wear face coverings. And this has been something that we've seen in other countries use, and I think the data isn't very strong because it actually it's dependent on what type of mask you wear. So if you wear a bandana that's very loose and hanging, I don't know how much protection you get, and you might paradoxically touch your face more. You might get a false sense of security and not social distance. And then anytime you walk down the street in Pittsburgh, you see these masks strewn all over the floor, all over the sidewalk, which I think it becomes an infection control risk for people to pick them up. So I think there's a lot of questions about them, but I do think one alternative might be face shields, because face shields likely protect the wearer as well because they cover your eyes. They're easier to wear, and they do serve that source control function. So I do think that a face covering is going to become the new norm, and it's going to be kind of universally recommended as a way of giving people safety and confidence when they go out the door that they're not going to be infected by somebody else.
What do you say to all these young people who are going to various gatherings, whether they be in the protest movement or summer holiday gatherings at beaches, not wearing face masks, not social distancing? What do you say to them about how they are spreading the disease?
This virus didn't go anywhere, and every activity we do, the virus is with us. You cannot behave as if this is not a pandemic and not suffer the consequences, meaning you're going to get infected or spread this disease. This is, I think, one of the misnomers is when all of these counties in Pennsylvania went green, they just picked the wrong color because that has a psychological connotation that green means go, and that didn't mean go. It meant we have hospital capacity, we have diagnostic testing, we have contact tracers. Not that the virus disappeared. The virus was still there. And I think many people who were surprised about the number of cases really thought that because Pennsylvania had such aggressive social distancing measures that when everything turned green, everything was going to be fine. And I think that was a naive way of looking at this if you look at the biology of the virus. So when you go out and do things, just remember the virus is with you, and there are simple measures you can take to decrease your risk of either transmitting or acquiring the virus. Wearing a face covering, staying 6 feet apart, avoiding really crowded places, washing your hands a lot, avoid touching your face. All of those simple things can go a long way to keeping the number of cases down and manageable. Just remember that every case we get, the Allegheny County Health Department has to do a case investigation. And if we're getting 200 cases a day, they're going to be underwater. They're not going to be able to keep up. And that's how you get chains of transmission started that may end up landing on vulnerable people who end up going to the hospital. So this is something that we need to do to keep control of this virus.
Some people say that because of the infection rate increasing among young people, that there are not that many deaths. Is this just a lag in death rates? Do you expect to see the death rates go up in the coming weeks?
So it's a little bit of both. It is definitely true that the epidemiology of this infection has changed. We are getting younger people infected. And the younger people don't necessarily need to be hospitalized, and they're not representative of the deaths. It's not a very serious disease for most young people. And it is true that deaths lag. If you are a vulnerable person and you get infected, you don't die instantly from this. It takes about 2 to 3 weeks for you to get sick enough, be hospitalized, to die. So deaths are what we call a lagging indicator, and they may even lag more because if it's younger people getting infected, they then have to infect a vulnerable person who then has to get sick enough to be hospitalized and die. So we may not see deaths increase for a period of 2 to 3 weeks. We may not see deaths increase as dramatically as well because we're getting better at treating this. We have new tools. We are much better at protecting nursing home populations, which represented the majority of our deaths in Pennsylvania at one time. And there was a time when the governor was mandating that nursing homes take COVID patients, which was a mistake and led to deaths in nursing homes. So I do think we're getting better. So we won't see the deaths rise as dramatically as they did early in this pandemic. But I do think we have to be prepared to see more deaths in this area. We just have to basically wait for this virus to make its way to vulnerable populations and people to get sick enough.
Dr. Amish Adalja is our guest. He's an infectious disease expert. We are talking to him about coronavirus. Our number here is 412-333-PCNC. We've got one more segment with him. If you'd like to join the discussion, then call that number. We'll be back in a moment.
When you put on Channel 11 Morning News, there is a team that has been working all night to get you the news you need.
The news doesn't stop. We don't stop. We want to make sure you know everything you need to know to get prepared for your day.
We decide what is the most important thing that you need to know when you wake up.
Once a story goes on air, that's just the beginning. It's going to change throughout the morning. It always does.
That's why Channel 11 Morning News is here to get you prepared. We have the breaking news desk. We have Scott and Tricia looking out for you as far as weather and traffic. When you walk out that door, you're prepared.
What makes Petite Kitchen and Bath so special? As we've always said, at Petite, it's all about you. Beginning with our design experts who create your dream kitchen or bath the Petite way. Choose from a wide range of selections that you won't find anywhere else. We guide you through the process every step of the way. From custom creation to expert installation, Petite makes it simple and easy and more affordable than you might think. Petite Kitchen and Bath Design Center. Haven't you waited long enough?
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
If you or a loved one has mesothelioma or any other asbestos-related cancer, call now. Asbestos manufacturers sold deadly asbestos materials to thousands of companies, putting workers at risk. An estimated $30 billion in court-ordered trusts have been set aside to pay out claims to asbestos victims. You may be entitled to a portion of these funds and receive compensation without filing a lawsuit or ever going to court.
For your free legal consultation, call 1-800-568-5308. That's 1-800-568-5308. I'm a non-attorney spokesperson.
Infectious disease physician Dr. Amish Adagja is our guest. We're talking to him about the coronavirus. You're not surprised to see the coronavirus rise here in Allegheny County again either, are you?
No, I'm not. We knew that this virus was here. We were having a very low number of cases because people weren't socially interacting. But when people started socially interacting, traveling to places like Myrtle Beach, which is a hotspot, traveling to Florida, which is a hotspot, it was inevitable that they were going to bring this back and they were going to spread it. You know, I spent some time I live in the South Side Slopes, and I was walking around the South Side Flats, and I was looking at some of the bars and how crowded they were, and I knew that those were going to be a powder keg for transmission. And indeed, we have seen bars be a real driver of infections in this county.
Well, how do we balance the need to open the economy and get businesses working again with controlling this terrible disease?
That's a very hard thing to do. And one of the things is a couple of principles that I would advocate. One is don't just look at the number of cases because they're going to go up. You got to look at other things like, for example, hospital capacity. Are the hospitals okay? Are the ICUs okay? Do they have enough personal protective equipment for the healthcare workers? That's the number one thing. Then you have to look, is the percent positivity of testing going up? And it is actually in Allegheny County, so that is worrisome that the number of tests that we're doing, that there's a higher number that are coming back positive as there were versus like a couple of weeks ago. That's another thing to look at. The other thing is, do we have enough case investigators and contact tracers at the health department? And I don't think I think the answer is no. I think they're likely not enough of them. We need to make sure that the health department is adequately resourced, staffed, and prioritized by our public leaders to be able to hire these individuals very quickly without all the friction of being hired by a county government and all the background checks and all the paperwork. We want to make sure that they can rapidly scale up in order to do that. And we have to know that we're going to get cases, and we have to move to kind of a harm reduction paradigm, meaning we know the virus is going to cause cases. We want to try to limit the damage, and that's by being very aggressive with cases, being very targeted. What's causing the cases? Is it people going to bars and drinking, or is it people doing something else? And really intervening in those areas where we see spread based on the epidemiological data, not being very blanket, but being very nuanced, having clear metrics and having certain time frames. Say, we're going to do this for 2 weeks and we're going to make a decision based on that. We want to be very nimble how we do this in this next phase of the pandemic. And I think it's going to be rough until we have a vaccine, and it's not going to be something that's easy, and it's not something we're going to be able to avoid all the pain from, but we need to come up with a plan to realize that the economy is people's lives, and we are hurting people's lives when you shut down restaurants, for example.
Well, the Trump administration has come up through with ICE a plan to exclude all immigrants who are attending universities that are going to virtual classes and sending them home. Do you think that and a great many of these, at least a third of them, are from China. Do you think that will have any impact on the spread of the disease?
No, that has nothing to do with the disease. That is a political move for a policy that he's been trying to advocate for some time, and they're using the pandemic as an excuse to change things in terms of immigration law. So this is really just a very brazen attempt to exploit the pandemic and people's fear of the pandemic to take other policy actions that he's desired.
I asked you about this in the first segment about the other diseases that are out there. You say that there is a new swine flu that is emerging in China, and because you've been so dedicated to looking at COVID-19, it's taken your attention away from those kinds of diseases, those other epidemics that could be upon us. How concerned are you about the new threats that are emerging now?
Well, I am very concerned about the swine influenza strain that's emerged in China. We know that it's already infecting individuals, and this virus has the ability to infect humans efficiently. We don't know that it can spread from person to person very well, but it has a lot of genetic characteristics that suggest that it could be a virus that could make the leap into humans and have sustained spread. This is something we have to watch. Influenza has always been the #1 pandemic threat we as humans have faced, and there will be another influenza pandemic. And we need to keep preparing for these. We need to start developing better vaccines for flu, better antivirals, and keeping our guard up with surveillance, looking at these viruses in birds and in pigs before they jump into humans, and not ignoring it. We can't let what happened with this coronavirus happen again.
How much is testing contributing to the rising numbers of coronavirus cases, if at all?
This is a false narrative that's being spread by a lot of people. If you look at the percent positivity of tests, how many are coming back positive, you can see that that is rising faster than the number of tests, meaning that the virus is outpacing our increase in testing. We are testing tremendously more than we were in March. Maybe 700,000 tests in some days are getting done. But the percent positivity is rising in places like Arizona and Texas and Florida. Even in Allegheny County, it has risen. That tells us that our testing is not the reason for this. This is actual community spread going on.
We're talking now about other treatments and new drugs. What is the horizon for that in terms of treatment of COVID-19?
We already have one experimental antiviral called remdesivir that received FDA emergency use authorization. We're using immune modulating drugs like steroids and other drugs for rheumatoid arthritis type conditions. So drugs like Actemra, which work on parts of your immune system. We're using those in severe cases. We are developing antibody-based treatments. All of these are kind of all happening in tandem, and we already have new tools now that we didn't have in March. But I do think it will probably be until the fall before we get really highly effective treatments like antibody-based treatments that may decrease the mortality in hospitalized patients significantly.
And I've asked you about a vaccine before, and you said until we get one, we won't really be safe from this increasing pandemic. What's the horizon for development of that, and how do you feel about the efficacy and the safety of such a vaccine developed so quickly?
We are moving very rapidly. We have Operation Warp Speed, which is already starting to manufacture vaccines before we know if they're effective. This is something that is unprecedented. We have multiple candidates now in advanced clinical development, but I do think you have to remember that vaccine development is something that is measured in years, not in months, and we may have some batches of vaccine at the earliest at the end of the year or the early part of 2021, but not enough to vaccinate the population of the United States or the world. And I do have confidence in the efficacy and safety. That's not what's being sped up. But the speeding up is the manufacturing, and manufacturing ahead of time, which is being done at tremendous financial risk because some of those vaccine candidates may not make it through. So I don't think that there's any question about whatever gets released, if it's going to be safe and effective. And we're already seeing good efficacy data. So I'm pretty confident that we will have a vaccine. It's just that I don't think we will necessarily have the country vaccinated by the end of 2020 or even 2021. So maybe a 2-year period to get everybody vaccinated.
Well, given that, how safe is it for us to venture out and go to restaurants and eat?
So this is something that's going to have to boil down to an individual decision, that each person has different risk tolerances, and each person has individual risks for severe disease. So you're going to have to kind of do a calculus every time you step out the door about whether what you're doing is worth it for you. And it's going to be different for different people. And there are going to be values that people will pursue that are going to put them at risk for the virus. And I think that's going to have to be an individual decision. And we can't dogmatically apply social distancing to every situation. I mean, we saw it with the protesters. The protesters rightly thought that protesting these injustices was more important to them than the risk from the virus. And I think that that's going to be a proper way to think about this virus going forward, is that this is going to be with us, and we have to find a way to balance those risks individually. And as long as the hospital capacity is okay, I think that we're in a position where this is like any other risk that we're going to have to make a calculated decision about.
Well, Dr. Adaja, finally, Dr. Fauci has said that this is we're knee-deep in the first wave of this disease. Do you agree with that assessment, and why?
Definitely. We have not gotten through the first wave, and now we're seeing surges in states that were kind of spared early on in the first wave, and we may not even get distinct waves. It may be a slow burn where we just have this certain number of cases that go on, and maybe they intensify when it gets to respiratory virus season in the fall, but we don't even necessarily have enough control to even have a trough to be able to call something a wave.
All right, Dr. Amish Adagja, infectious disease expert. As always, we appreciate your time. We remind everyone that you warned us about this first way back in January of this year. Thank you very much, sir.
Thank you.
All right.